Dear friends, we're happy to welcome you at our new episode of BG Dental Tips. And this one is dedicated to a tip before you start doing endodontic treatment. The trick that you probably have to provide for every single patient that will help you to do something else after endodontic treatment. Let's go. Okay, so that's our initial case, irreversible pulpitis. Patient came with pain, and we have to provide and to perform a root canal treatment in such a case. What you can see here, you can see decay on the mesial side, you can see a big filling, you can see some light cracks, whatever. And basically, sometimes it's very difficult for us to understand what kind of restoration is better to perform straight after endodontic treatment will be finished, okay? Rather, it will be direct restoration, freehand composite, or it has to be done in indirect way with an overlay, veneer layer, or even sometimes a crown, okay? So in such cases, you definitely have to explain everything to the patient. You have to agree with the patient possibility to do indirect restoration, because sometimes they may think that since they have already filling, you will do a new filling afterwards, but you know that sometimes it's impossible, because after the caries excavation, they will be very thin wall, and actually you have to do cusp reduction and cusp coverage. So what I'm trying to say is that it's better always to start these cases with one thing, okay? And here you can see how we start. We take a half of the tray and we make an impression, okay? Why for? Because if I will do indirect restoration later on, which happens in many of the endodontic cases, what I can do my preparation for overlay, for crown, and I can do temporary restoration straight after, okay? So it will save a lot of time and a lot of energy and a lot of stuff related to restorative parts. So here we can go for the endodontic treatment. You can see that the caries was pretty intensive. We drilled out everything. The distal was also a cavity, and for me, these kind of teeth are better to be restored with overlay. So we do cusp reduction, and then we do cusp coverage. And by the way, if you will decide that it has to be done that way with the cusp reduction and the cusp coverage later on, during endodontic treatment, you can start doing your cusp reduction, and it will give you a benefit that your access will be easier, the accessibility to the tooth will be easier, the working length will be shorter, and everything will become way easier and less stressful as before you start the case. So this is after we finished endodontic treatment. You can see the part of the preparation is done, and here is the final preparation and build up already straight after endodontic treatment. Here you can see some x-rays before and after root canal treatment, and here is temporary restoration, okay? So we were able to use this initial impression to make a temporary restoration straight after endodontic treatment was finished. Don't forget to put like to this video, to share this video with your colleagues, and also to follow us up on our YouTube channel for the more interesting clinical content. And don't forget, if you start doing any kind of treatment and you do not know exactly if you will do filling or indirect restoration, start your treatment with impression, and then you will use it later on, okay? See you next time. Bye-bye.